Muy buenos días a todos y todas. Estamos muy contentos de
Good
poder.
morning, everybody. We are so happy to be here in this webinar organized by the practical community of PSEA, as well as the PA group. We will give 3 seconds to confirm, just to make sure the translators are translating. And as we said before, we have the option for interpretation, so you can listen either in Spanish or Spanish. My moderation will be in Spanish, as you may know, and some parts in English, some parts in Spanish. So welcome everybody to this webinar, which is Feedback and Complaint Channels, how to create subsystems for listening and managing complaints, and in Spanish, canales de retroalimentación y queja, y cómo crear sistemas inclusivos para la escucha y el manejo de quejas de la comunidad. I just want to make sure that translators are with the system and that everything is working properly.
Ok, perfecto. Entonces
Perfect. So let's start. Just to bear in mind, we also have our chat and the option for Q&A. In the logo where it says interpretation, you can choose the language to listen. We have now 81 participants, so let's start with this event. We are so happy and thankful with our speakers today. We have experts. It's an amazing opportunity. On the one hand, we have Anaima Sai. She is the public officer of the operations and emergencies department. We also have Clara Lerich in the region in Venezuela. She works for OCHA Venezuela. We also have Hugo. He is a project manager of OCHA Venezuela. We also have Elisa Becante. He works for the Community Accountability Delegate for FIC in the Africa region. We also have Catalina Ciniegas here in Colombia. She is our coordinator for prevention of sexual assault of the office and the resident of Colombia. And we also have Andrea Talle. She's a specialist of UNICEF Colombia. Elena coordinating or co-leading for 4B, Claudia, and well, all the colleagues. I mean, we are sitting behind this scenario, waiting or expecting to have a nice webinar to learn a lot. We will have 3 parts. The first will be a presentation part. We will talk with our experts. The second part will be for Q&A, and then we will have a brief recap at the end, just to close the event. And with any further to say, I will give the floor to Dalma Saeed.
For working after hours for this webinar. You will share lessons from your experience in Pakistan, right? It's an experience where IOM set up an interagency and feedback complaint mechanism, a call center. And we wanted to ask you, what can you tell us about that process? How did you develop and implement this line? What were your success factors, and perhaps where did you find the most challenges? The floor is yours, Naima, and thank you again for joining us.
Thank you, Monica. It's my pleasure to be here and to be on this panel. I'm sure I'm going to be learning a lot from the panelists here. To just make a slight edit to what you said, I'm going to be talking about my experience, not just about setting up the call center in Pakistan, but also a little bit of what we did with the interagency call center in Iraq. Because again, the interesting thing is that they were both Muslim countries and both have actually almost a similar background except in Pakistan, when we set up the call center, this was during the 2010 floods, so it was a natural disaster. Whereas later on, the call center continued to be used when displacement took place, when the Taliban were taking over the northern areas and the tribal areas of Pakistan. In Iraq, the call center was set up again after ISIS started creating issues, and there was the Mosul crisis, and war broke out in Iraq. So to start off with what you said, basically, I think during this time, especially, I would say between 2010 and I would say 2015, this was, I think, the height of when communications with communities, the concept was really beginning to become a major factor in humanitarian response. This later morphed into what we now call accountability to affected populations, but CWC basically took birth, I feel, the concept started taking birth around, I would say, 2009, 2010, especially in Pakistan. Um, the main thing was that there was a dire need for information, and it was becoming more and more prevalent that when an emergency starts, there's desperate needs, of course, for logistics, for health, for water and sanitation. But at the end of the day, we also need information, because without information, you cannot save lives. And information, indeed, the right information at the right time actually can save lives. And this is where the idea of setting up the call center happened in Pakistan, especially during the floods. And at that point, there was a lot of agreement from other UN agencies as well. The other thing that went in our favor was that, as you know, a lot of, sometimes when you call a bank or you call any business, they will connect you to a call center, especially if you're calling an airline or something. And most of these call centers are actually not based in the country. They are based in places like Pakistan. They're based in places like India. So Pakistan actually already had this very good infrastructure set up of call centers, which is what we were able to tap into. So between that and the fact that telecommunications was on the rise, connectivity was way better, especially with mobile phones, it was a very ripe market to set up a call center. And with the right equipment, we had good people, especially in IOM. Our IT guys were very helpful through connecting us with the right organizations, the right companies, where we were able to set up a call center, and it was being used throughout. People were able to call in, and again, during, I would say, 2010, people were still using landlines a lot, so the calls were mostly free for everyone. So that was a very big advantage. To quickly jump, that people could call from their mobile phones as well, and that they were incurring the least amount of charges when they were calling from their mobile phones. We made it very clear that if people call from a landline, then the call center was free. But if they used a mobile, we made sure that we let them know, because this is one of the lessons we learned. You had to inform people that minimal charges would apply, because some people would get upset that, oh, you said the call would be free, but my balance has been reduced. So these were like, some of the things that which helped us set up the call center. Then also informing people, depending on where you were in Pakistan, using newspapers, using the radio, that really helped. In Iraq, nobody reads newspapers because people didn't have access to newspapers. There was nothing on radio. So our main way of telling people about the call center was basically through SMS. So mass SMSs were very popular. This is how people were beginning to find out. We actually got in touch with all the major mobile companies, and we requested for their help. And in fact, a couple of them were able to do this for us for free as like a contribution to what was happening in Iraq regarding ISIS. very quickly going on to what you said, that where the success, where we felt like, there was some successes. I think it really helped that we, with both the call centers, we had very clear guidelines and SOPs. And the other thing that we also did, that we looked at other countries that had had call centers. And I think one of the best things that any organization can do is, and this is where knowledge management and institutional capacity really makes a difference, keeping track of the lessons learned and the best practices, because it can really help other organizations as well. So for example, like we had figured out some best practices and lessons learned from Pakistan, which we applied in Iraq, because the context was kind of similar, but then you can also tweak some things along the lines of uh, where you are and what the response is based on. So I think for us, setting up proper SOPs, training the call center operators, especially when it came to dealing with people, dealing with people whose lives have been turned inside out, how to deal with them in a sensitive manner, not to be polite. And the other major important thing for any complaints and feedback mechanism, managing expectations, because people will call in, they will expect you to solve all their problems, and you can't change that. So what you can do is you can manage their expectations. So you can tell them in what ways you can help them and in what ways you can't help them. And this is where the other thing that we also found very useful, keep having frequently asked questions, having a database. What are the questions that are coming the most? So that sometimes, even if you don't have an answer, and these questions are coming again and again, you actually reach out to the right person and ask them, you know, these are the questions that are coming. For example, like returns, there are a lot of questions about returns, and you reach out to UNHCR. If there's a lot of questions about food, you reach out to WFP, find out from them, what is it that we can do? So that definitely helped a lot. And the last thing, and the other way we were able to tell people about this call center, not just in Pakistan, but in Iraq as well, we got these small cards printed that were put in NFI kits, that were put on top of everything, shelter kits, things that were going out. And this is where the idea people had that, okay, if you have a question, you can just call this number. Just to wrap up what you were saying, the challenges I've already touched upon a bit. People call in, they want solutions. The other thing, which we later cover as well, it was hard for some sensitive topics to be discussed, like talking about sexual abuse and exploitation. That was a bit, especially in Muslim countries. And I don't think this is just even a question of religion. It depends on how conservative your society is. So I think that was a challenge for us in encouraging people to call in and talk about the issues. Um, the other thing, which is again, I think a challenge that we still face, getting senior management on board about the importance of complaints and feedback mechanisms, because especially depending on your mindset of the mission or of the leadership, it can be quite a challenge letting them know that the negative feedback that we get is actually good for us, and it holds us accountable to the people that we are helping, and also actually is good for us to let our donors know that, hey, not everything is perfect. It's sometimes we tend to do this. We just want to make everything perfect. So if anything negative comes, we tend to ignore it or think it's, not an issue, or it's just not dealt with. So I think that was, those were like some of the challenges: sexual abuse, getting senior management on board, managing people's expectations. These were some of the challenges that we faced.
Thank you, Naima. That's brilliant. I perhaps would like to go back to the sensitive issues because you
Mm-hmm.
spoke about so many interesting things, managing expectations. You spoke about referring things to different agencies. So you talked about SOPs and training. How did you manage to integrate PSEA into these lines? even though it was quite challenging. Sorry, that was for me to tell you to stop. How was this process, and how did you manage to sort out some of these challenges you did mention?
Very honestly, Monica, I think those are challenges that still we still face. I think it's like I said, in Pakistan and in Iraq, it's almost a cultural thing because it's something that you have to fight. It's a societal and cultural thing. But I think GBV and PSEA were two factors where the interagency connection really helped because we reached out to other organizations and NGOs that work on this, and we asked for their assistance as well. And in this case, we learned that the initial, shall we say, setup of integrating PSEA and GBV really needs to come face to face first, as much as possible that we can do face to face, where we talk to people. And in line with that, that was one of our lessons learned as well when we were setting up the call center. Um, Talking to communities is important in figuring out, like, what is it that they would prefer. So with PSEA, it was one of those things where to explain the concept, of course, there were focus group discussions and face-to-face and wherever you could go, where you can have women together alone without the men hovering about, then letting them know. And then, of course, the other thing is really promising them confidentiality, that nobody would, that their names would not be revealed, that they can use fake names or something. And I think in that way, working through the GBV task force, working through other agencies that were working on PSEA, we were able to set up some standards on how we were going to inform communities, whether they were men or women, on how they could call in. The other thing was, for example, in Iraq, we had a separate number for GBV because we did not want them. In Pakistan, by that point, we did not have that. But in Pakistan, what we did was for GBV, we just set up, we got a mobile phone. So it was separate from the hotline. So if people wanted, so that they were sure that this is not the same number that someone was listening in or whatever. So we told everybody, same in Iraq, same in Pakistan, that for the GBV or for PSEA stuff, we have separate numbers. So you can call in that. The other thing, making sure, depending on the gender, if it's a woman calling, making sure a female operator picked up. If it's a man calling on that line, making sure a man picked up, So I think in that way it was those are some of the ways we dealt with it, but it's still a challenge, I'll be honest. PSEA, getting people to report on PSEA is still a challenge, and this will continue to be a challenge till maybe like we have better access to females. I think maybe in other countries it's easier, but in Pakistan, it's particularly challenging to get women alone. They don't even get, they don't get time alone as much away from the men. So we would have to find those pockets, for example, when women would get to go to get water. In Iraq, it would be interesting. Some of the camps, we had like these little places, I wouldn't call them beauty salons, but where women could just go and, spend some time or whatever. That's where we could get some women alone and talk to them. But in Iraq, it was still easier to get people away from families and get women to talk about this. In Pakistan, it was a problem, especially when it's not a camp setting. One of the examples that was used by another NGO, and we found that fascinating, in Pakistan, actually, they would go to these salons, small salons where women would be getting their hair cut, or they would be getting their threading done or something. And we would, they would try to talk to women that, oh, we are here from this NGO and, we want to talk about PSEA and, and some women would not respond, but some women, they would feel safe in that space. So they would reach out. So these were like some of the things, but again, like I said, still challenging, but, we're working on it.
Thank you for being so generous with all that experience and all that learning. I'm sure there's a lot more that the participants would like to ask you, but I think I'll move on to the next participants and we'll come back to you with some questions around many of the topics, many of the very interesting topics you just mentioned. So thank you again, Naima.
No worries. Thank you.
Bueno, vamos entonces a hacer un viaje otra vez de regreso a la región. Vamos a
So we will go back to the region. We're going to speak now with all the workings that all the people that are working with API. And we're going to speak about the EASY framework and it has resulted in the creation of these lines in which they will speak about today. And we are the first region to adapt an interagency framework and to reinforce the links between AP and PSPA, and that is very mutually helpful. And we can share the material on feedback and the complaints channel and tell us what they have learned till now and what are the plans to be able to speak about what we need to go on. Thank you, Monica. Good morning, good afternoon to everyone. My name is and one of the things that we have learned before giving the word to Abner, one of the things that are important were leadership. That is something that Naima was speaking about in the intervention, and a factor that can allow to develop other mechanisms. And in the case of Venezuela, which is a humanitarian operation whose structures were established 3 years ago, since the beginning, AP was a topic that was raised in the humanitarian teams in the country as a leadership, strategic leadership, and it was one key issue that one thing has been very important to have the expertise and technical leadership on AP. And since the very beginning of the operation, we do have an AP advisor in the collective has allowed to develop this joint understanding on what is the requirements and the minimum request that we wanted to commit to as a humanitarian system in Venezuela. And this has resulted in the development of a collective framework in APE that has been agreed upon in a humanitarian network 2 years ago with 7 topics, how to reinforce the capacity of all the partners in the country on AP, to a commitment for the pillars of AP, the coordination, the importance of the cycle for the communities, and how we have used it and how we have set it down. And one of the 7 key commitments was the creation of an interagency mechanism that is sure and accessible. And there we have the initiative of the interagency contact line. And now, Abner, you have the floor. Hello, colleague. Good morning, everyone. I'm Abner. I also work in the Venezuela operation. It is a pleasure to say hello, Fernanda, and to find you at this space. And also in the terms of the contact line, as Clara said, it is an interagency effort that is very important to consolidate the accountability scheme and the link with the network against exploitation and sexual abuse in efforts that are centered in people, and that where we give the importance to listen to their voice, and where we challenge ourselves as humanitarian actors to use this people's voice and to include it in this humanitarian aid cycle. We must say that it is not only aimed at the fact that having a line or an interagency mechanism that completes those existing, but it is also an important effort to have a mapping on what are these feedback types that we have from people that we could receive from communities, and also to think about the strategies on how to focus on these kinds of feedback, and that results in a common job for the agencies where the effort was prioritized and always centered in the people that we serve, making the appropriate links so people with a very specific need could have basic services such as access to legal identity and some cases and uh, nutrition schemes, and victims or survivors of gender-based violence, and to have access to the psychosocial help. This line is now has 8 agencies of the UN system established in Venezuela. And as long as we are creating and escalating our response, we are creating other topics such as gender topics that are transversal and that we care a lot on the guaranteeing of women, men, and children, adolescents, or people with fluid gender can be feeling safe and trusting on this, and that they can express their voice. This effort is integrated by UNAID, UNICEF, OHA, the Human Rights, the United Nations for Human Rights in Venezuela, the IAM, the UNHCR, and OCHA has recognized as an actor that is impartial to guarantee the transparency of these mechanisms, and it has been embedded in the architecture as another space of coordination based on people, where we open a space to listen to the community's voice and to see how to articulate the response or to comply with our mandate of always delivering a coordinated response, effective and based on needs. So we must rescue some achievements such as this one, precisely the OCHA leadership as an entity that leaders the interagency coordination, and not only within the UN system, but with other factors such as the international organization, local agencies, and the civil society movement. The prioritizations of efforts to solve the type of feedbacks that we have established and identified, which ensures us to be agile in the response and in the management, and how to include this feedback in our daily activities. And of course, the completion of all the efforts on accountability and the network of exploitation and protection against sexual abuse. It has been a joint effort with the coordinator of the PSEA network in Venezuela, where we only do we have the contact line as a method of accountability and feedback from the communities, but also the mechanism that is harmonized and homogeneous enough for the promotion of the protection and against sexual abuse. And the line helps to fulfill the basic pillars of action, so to keep confidentiality, give security, access, operational issues, and the variety of channels where the victims or survivors of sexual abuse and exploitation can choose what is the media that you want to use. And this is linked to the PSEA network, where we do all the analysis of research and give responses, and always guaranteeing to close the gap with the victims and the people that have started this accusations, and helping them to fulfill their accountability commitment. And this network is a very active part of this effort, anti-interagency effort, where we take decisions on how to escalate the responses that we offer from the line, which has been one of the most valuable achievements for us. And as all achievement, it has its challenges. And when we escalate the response, when they are in the center of what we do, and it is a focus of what we do, we have to say that we have a very low funding from the donors, and this places at risk the operational continuity of these mechanisms. Now, how have we solved this? Well, today, the agencies of the UN system are part of this interagency effort, give support and contribution to keep the effort and to maintain operational continuity. However, this is one of the latent challenges that we have to overcome on how to make an incident set to increase these efforts and continue to have them funded, because this is what allows us to build responses and mechanisms within the humanitarian ecosystem. It is surprising how challenges are transversal at a global level, and it is the operationalization of information, how to make the focus of the humanitarian responders a change to be based on needs, opinions, and decisions that people have the right to make on any action that affects them. So I think that we have a major challenge there, a challenge that is we face at all times and with all interventions, and how to end and to close the cycle with the person, but also to show that their voice are important, and that is part of a change that we introduce in the focus that of what we do. And of course, what is the parallel shift to all the humanitarian ecosystem. We all want to have this mechanism. We all want to listen to this voice because it's part of this focus that we are adopting. But we also have to take into account the reality of the communities where one community, a humanitarian actor, is a humanitarian actor, no matter what the name, color, flag, or whatever. And the multiple mechanisms create sometimes parallel uncertainties within the communities to know whom do I call to tell about my situation or this experience that I am going through. So we are all competing to listen to the people. But the truth is we shouldn't be competing. We should be collaborating, a joint effort, a common effort, a vision that is common, where we will bring security, safety to the person on notwithstanding the line or the way that they use it, and where their voice will be included in our humanitarian response project. So how do we sort of this ecosystem filled with individual mechanisms and parallel thinking that we have is one of the hurdles that we have to overcome, since the line from the line and the OCHA leadership of this effort of interagency coordination, how to review where the effort goes towards a resolution and not towards a reflection of the comments. So this is one of the specific challenges and achievements, but this doesn't put us down. We know perfectly well the importance they have, and how, as Martin has spoken in their recent speech. It is the experience of the people. It is to learn about them. And we have a great task to do. And we are aware that can take a long time. But the truth is that we have to push our agencies to change the way in which we program, always thinking and people-centered, people-focused. Thank you for your space. And you have the floor now. Go ahead. Thank you, Clara and Abner. A very important thought. I think that it's a transmission that will affect our next panel member because, of course, the idea of collecting all this data is finally to be able to adapt a response based on the capacities of the people that we are trying to serve, right? And precisely, and working with the IFSC, they have had a very interesting process on adapting this hearing recollection that is how they call it, very interesting. of hearing and integration of these visions of the communities. This system started in the crisis of Ebola and has been reflected proving, learning from the challenges of facing them, arriving to a mechanism that has now a regional scope. Elizabeth?
Process from Ebola to now, to the time now, adapting this mechanism, which is very interesting for us to hear about. What can you tell us about that journey? You started with a local organizational mechanism that has now an interagency and regional scope. How did you make that leap? And how, if at all, did you go about monitoring and improving it, right? So it remained fit for purpose throughout all these times. The floor is yours, Elizabeth. And again, thank you so much for joining us today.
Thanks, Monica, and thanks for having me as well and for letting me share this experience. I think I'll start by giving a bit of a background into the mechanism that we put in place in 2018 during the Ebola outbreak in DRC. It was an initiative or a partnership between IFRC and the US CDC. And we wanted to set up or put our strengths together to set up a community feedback mechanism with the objective of having this system in place to analyze community feedback in order to adapt messages based on community needs and provide recommendations to the immunization related pillar that we had in the country. This partnership led to the development of processes and tools to collect, to manage, to analyze, share, and manage and respond to community feedback, but in a systematic way. We wanted to make it as simple as possible. So we looked at the activities that were already in place during the Ebola response, which were mainly Ebola health promotion activities. So we tried to integrate in the volunteer daily activities, how they can collect and record community feedback. So we had around 800 at one time Red Cross volunteers recording community feedback views in the forms of rumors, observations, beliefs, questions, suggestions, notes of encouragement, but also complaints on the epidemic and the response activities. This data was then recorded as free text. So volunteers would go house to house, write down exactly what community members were saying, how they were saying it. And they would hand this over to data focal points in their office, who would put all of this information into an Excel spreadsheet. And these data focal points, with the support of IFRC and the US CDC, they coded this qualitative data using a coding framework, which helps to code information into, or qualitative data into themes. The feedback was then analyzed, highlighting the themes and the trends that we saw. And these main trends were then shared at local Ebola coordination meetings. We had over 1 million feedback comments that were collected during the response. So this was a very successful system in DRC. And when the when the COVID-19 pandemic broke out in 2020, it was clear that we needed a system to quickly understand what communities' concerns were, what their questions or their suggestions were as well. But the challenge was, how do we expand what was used in one country to 49 countries, which is the countries that IFRC directly supports in the Africa region. And how we started it was very slow process. We adapted the tools bit by bit, and we adapted it for the COVID-19 context. We wanted to keep it as simple and as similar as possible to what we had in the Ebola response, because we didn't want to introduce an entirely new system when we were in the middle of an emergency and we needed to listen to community feedback very quickly to understand what their perceptions and beliefs were. So we started to identify the most appropriate and realistic ways that we could collect and document community feedback. Part of that meant understanding which national societies, so which countries already had community feedback systems in place. What were their daily activities again? Were they doing household visits? Did they have radio programs set up? Were they doing health promotion activities? So we looked at those activities. We looked at existing feedback systems. And we also assessed which national societies were most invested in supporting with piloting this new adapted system that we had. So once we had our national societies identified, we piloted and tested the new versions of our tools with them. We learned along the way what was working well, what wasn't working. We made some changes. The national societies, they also provided us with their feedback, and they shared the raw data with us so that we could also see, you know, what additions or what features we could add, always thinking, how can we make this system sustainable and adaptable? So once we had that piloting phase, we then decided to expand it to the full region, so the 49 national societies. And the countries that were regularly sharing their feedback data with the region, we invited them to a 5-part training series where we talked them through the tools, and we did practical exercises so that they could try out the tools for themselves. And we supported them to integrate that into their COVID-19 program cycle. Since we introduced the feedback system in the region, we have now 43 countries that have community feedback systems out of the 49. So we saw 70% increase in countries that were suddenly collecting, analyzing, and responding to feedback. So that was a big accomplishment. But one of the challenges that we saw was that it's easy to set up a community feedback system to start collecting and documenting data, but to analyze qualitative data is very difficult, especially interpreting that information. So that's where the regional mechanism came in. So we started to support them more on the analysis of the qualitative data. So national societies would share their raw data with us on a weekly basis in the beginning of the COVID-19 pandemic. Now it's on a monthly basis. And we collated all of the data, and we analyzed it using a coding framework, which we adapted for the COVID-19 response. But we didn't stop there. We also wanted to build this mechanism within an interagency platform. So we wanted to make sure that the response was being guided by community needs and priorities. And in March 2020, with the partners, the regional partners, we set up a risk communication and community engagement working group. And within this working group, so we have East and Southern Africa RCC working group, and we have West and Central Africa RCC working group. And within both of these working groups, we have a community feedback sub-working group, which is chaired by IFRC and WHO. And the aim of this community feedback sub-working group is to share and discuss the main feedback trends and encourage action against pillars and agencies. So our process is very simple. Partners that have community feedback systems in place, whether that is informal or formal, so if they have any type of feedback from communities that they've gathered, they share that data with the interagency group. And we have a focal point who collates all of the main trends that partners have shared and analyze it using the coding framework. We then discuss recommendations with the partners and the main feedback trends. So we go through, you know, what was seen in the feedback data, and what, as partners, do we recommend to address the main community concerns that we're seeing. We then produce information products like PowerPoint presentations, a feedback report, and an online dashboard that we use to present the main feedback findings and the recommendations that we've all agreed on. And we use that to share with other partners and with other technical working groups. We also have an actions tracker where we keep track of the feedback trends, recommendations that we've agreed on, and focal persons who are taking on those recommendations. And we discuss, where are we at, you know, with this action being taken? What are we doing? Some of the things that this group has done is, for example, we've worked with the case management working group to improve communication on policy shifts during the COVID-19 pandemic. We produced videos that addressed frequent questions or concerns. We developed very practical guidance as well. For example, we did a PSS tips for social mobilizers that was in coordination with the MHPSS working group. We also co-developed a community, or how to find community-led solutions in migrant settings and refugee settings. We produced regular fact sheets as well. And we used the feedback data to inform social science research. And we produced some social science briefs based on the research that we found. We also started a new initiative. So we have a task force, it's called the Media Task Force, and we invite journalists to attend media webinars where we discuss the main feedback trends, and we support journalists to address those trends. So we've done a lot over the last couple of years, and in the last year, we went back to DRC and we reviewed everything that we had done so far within this community feedback mechanism with Ebola, but also with COVID-19. So we did a desk review of everything, all the tools and templates and research that we had done to develop the system. We organized key informant interviews with staff within IFRC at the country, regional, and Geneva level. We also had focus group discussions with community members, with volunteers, with governments. So it was a very, very thorough review of our feedback system. And we've now readapted it because we've only been able to use it during public health emergencies. And we wanted to be able to expand it to other emergencies and other operations, but using only the best practices that we've learned so far during the COVID-19 pandemic and the Ebola response. So that was the thinking behind that. And out of that, I guess, research, review, and monitoring process, we have developed a qualitative toolkit or a feedback kit, which can be used not only by Red Cross, Red Crescent, but by humanitarian partners to support them in setting up community feedback systems, coding this qualitative data, how to respond to the feedback trends that they're seeing, how to set up an interagency working group, how to share that with partners internally, externally as well. So it's very, very thorough, and we're just finalizing it now, but it will be free to share, I think, in the next month, hopefully.
And we can't wait here in the region, I'm sure. I speak for everyone here, but we're so looking forward to getting access to that toolkit. And thank you so much, Elizabeth, for all your generosity. I have 1 minute and one question. And I just wanted to ask you, I'm sure the audience will have a lot more questions, but I wanted to ask you about sensitive issues again, since we have so many PSEA folks on the line. And how, if at any point, have you been able to integrate this into your tools or into the process, and what have been the challenges and the lessons you've learned?
That's a good question. We've integrated that into the community feedback system. We always tell national societies to consider how they're going to be collecting sensitive comments and to do it in a way that is not the same system that they're using for general feedback, because people are more shy to share that type of information if it's in a group, for example. So we encourage more channels that allow anonymous information to be shared, like hotlines, for example. So it's not this face-to-face interaction. We work very closely with PGI, which is our protection department, on setting up SOPs and guidelines on how to handle community or how to handle sensitive feedback. Yeah, and that is going to be part of the new feedback kit, because that was one of the gaps that we had noticed, is that it's very easy to set a system up and think that sensitive comments are just going to be going through, but you need community trust before you can have that system working. So it's building that trust first, and then making sure that people understand or know that you're listening to their comments and that you're responding to it, that you're, helping them to and taking action based on that sensitive feedback that you're receiving. One of the things that we did for DRC, which is a good example, is that we had this hotline that we set up for sensitive comments, and we created a working group between IFRC, ICRC, and the DRC Red Cross to discuss the sensitive feedback comments that were coming through, and then together say, how are we going to address this? Not all of them were PSEA related. If they were, we would have one focal point that would just be in charge of handling that, and they would share that with the right person, whether they had a PGI focal point in country or someone that supported in managing that data, and that would then be reverted back to or dealt with at an individual level. But yeah, so that's what I have to share. I just have to say, because I think that's been said quite a lot in this group, is that it's definitely something that I think needs a lot more work on. And I think, having proper processes in place to help build community trust and be able to handle that feedback appropriately and respectfully with dignity, is very important.
Thank you so much. I really like that closure. Yeah, it's all about trust and building the right systems and learning, right? You give us a great experience about a learning journey. And I think that goes very well into our next presenters. I'm going to switch to Spanish now, but I want to thank you, Elizabeth, again for being here. Continúo en español y creo que para cerrar, claro, lo que Elizabeth...
I will move on in English, and as we mentioned, it's a whole experience and an adjustment situation as how we are fixing the situations just to make them work. It is not an easy task. I mean, in all the presentations, they have talked about the different challenges and the need of to observe ourselves to know what's working or not, and what we need to do to continue improving. And the next presentation we have, and again, is about our region, Colombia. Catalina will talk about an exercise of assessing ourselves to observe the channels we have now in a region of Colombia and to see what we can add, what we can improve, and how we can move on as well in the activity, or I mean, to this extent, which is our responses covering everybody's needs. So Catalina and Andrea, recently through the task of the PSEA, you made a characterization of the channels of complaints and management. So I wanted to ask you both, why would you like, or why would you like to be involved in this system, and what have you learned? I don't know which of you want to answer first, but I mean, I give the floor to both of you. I will start, and for sure, Kata may supplement my answer. Let's say at the end of 2020, we were working in an exercise, in an action plan of the task force, and one of the most important gaps we identified in that statement was to work with communities, let's say, to understand better how we were working in the lands or in the territory in terms of communication, of the quality of those mechanisms, and also in the dialogue mechanisms and reports as well. Definitely was one of the most critical points of our action plan. We also had, let's say, important efforts related to internal capabilities. So let's say organizational capabilities, working with people, and also the migration to basic processes and standards, not with communities per se. So we made a decision to put like a special highlight to this point. So I think that if you have the outcomes on your hands, so we need to see what are the challenges you have now to understand better, or just to understand what was and how was our work related with communities. What we did is to identify a land, in this case was Arauca, and which is close to Venezuela, and it has an affectation due to our movement and the human crisis due to the migration. And also the institution capabilities as well. So we choose this land, and besides this, we made additional efforts in terms of PA. So that's why we decided, or we choose this region and a number of stakeholders, either agencies or organizations that were working also and that are working with this link. It was a very huge challenge. So Arauca was the territory or the land we chose. And we also made a process, a qualitative and a quantitative process for getting a characterization in terms of numbers or types of agencies, in terms of quality of those mechanisms, just to know how we were fulfilling with the accessibility, safety, transparency, confidentiality as well, and all the topic of accountability covering all the needs of the populations. So we also perform different interviews to focal points, and also the personnel that were in the first line giving the answer. And of course, we also perform remarks in the field. We also ask the communities, and also we make a documentary consultation just to understand better the processes by the institutions and together with all the stakeholders. And what we found out is that the vast majority, or it is highlighted in terms of reporting, complaint reporting of communities. Let's say that what we found is that mails and also telephone channels are more useful in the lands or in the territory. Those are the first mechanisms that, in terms of direct communication with communities, is what agencies have and organizations have related to work. And regarding communities, and of course, the topic of when observing the accessibility topics, what we saw or what we identified is that all channels are free. However, somehow they have an issue of internet access, or availability of mobiles, just to file the complaint. The one that doesn't have this problem is the part of the mail, because in this way we are having, or we are guaranteeing the services, but not the opportunity part in terms of management. Let's say that reporting or that report of that information we are getting in a promptly way. And somehow, and the most interesting part here is that we can say that the majority is under a socialization process. It's not just about to have a card, a simple card, but there are certain schedules to have or they spend time together between the communities, and they exchange experiences so they can be more accessible, more comprehensive. It is important to consider that when we're talking about the community of Venezuela, somehow we need to consider the part of language. This is so important because we speak Spanish and we don't use specific terms to refer to determine issues. So what it is important here is the part of, or in terms of safety, well, somehow there are minimum standards of safety in terms of confidentiality, and people in the territory, let's say 70%, they are able to manage the reports in the territory. This is so important because not necessarily depends on the focal approach to make a management of the case and of the report. So this was so meaningful for us. And now let's say concerning confidentiality or privacy, we have certain challenge there. We will say that we're still needing to improve what it has to do with the consent process for children and teenagers as well. Not all of them have in a systematic way the part of consent part. They are in that way. And also, we also find that for sure there are organizations that effectively they train their personnel in a systematic and permanent way just to make sure these private issues or topics and safety issues are clear in their work with communities, and somehow they can convey clearly what we're talking about when we say it is a private communication and safety issue. And concerning the topics of how these mechanisms are adapted to the needs of children and teenagers, and of course for women. For instance, what we found is that there are certain organizations that effectively they're adapting these mails that normally work for adult people with pieces of communication and materials for children and teenagers. And in this way, they can perform the report of the situation they would like to choose, also the ideas, and also this means that they also have an accompanying processes in those spaces in case children may present this. Let's say there is a very meaningful topic in Colombia, is the part of NICO. We work with indigenous people, and to make this adaptation and to communicate with this population, there is a very important gap there, and we identify it. It was a very interesting experience to talk about gender violence in a wide sense, and also to incorporate the topic of ideas, because it is a territory where we are surrounded by armed groups, and talking about this means, or it may mean, a higher risk for these communities. So we need to establish labels in a wider way based on violence, and in this way we can incorporate ideas or topics. And yeah. Yes, Andrea, thank you very much. Thank you so much for sharing these important topics. Maybe Catalina, if you want to say something else about these strengths or challenges, particularly the integration of PAs, and what will be your recommendation for this from these findings you have towards the people that are working on the response. And thank you so much. Thank you so much for inviting me. And just to supplement what Andrea mentioned before, I will say that for us, it was a huge challenge because this was the first time that we made a very strict exercise. And as Andrea said before, with different information sources, with this exercise that we promote this through the focal points, and we had a participation, and we found the support of 29 entities of the system, agencies for verification as well, and NGOs that have presence in Arauca. And it is also important to say that our objective, it was not only if mechanisms were fulfilling with the minimum standards of LEACs, about having a report in case of sexual assault or exploitation, and how this was referred to this assistance support. It's not only to observe the mechanism or the performance, but what happened after and how we were dealing with this with the agencies or NGOs or possible cases of sexual assault and exploitation. What else we saw? Okay, in terms of this compilation or in this gathering, by observing the territory and the work we've done with the territory, we also open our eyes in the gaps we had before. Andrea mentioned before, for example, the topic that related to with communities, with ethnic origin, and the exchange we have with indigenous people. And also there is something that called our attention of participation. We saw that participation is not something that can be analyzed in the construction mechanisms or in the building of the mechanisms per se. So to know what are the best manners or the best ways or the most accessible ones and the ones that are more accessible. So we haven't had any previous consultation with communities, so we have a specific emphasis in this, and our approach or our objective is not only the characterization from the good practices we identify in the country, but also there are some other practices in the country that can be landed to our context. And we also see that in this scenario, we need to diversify all the communication channels, and in order to receive this possible exploitation and sexual assault reports and to be adapted to the needs, especially to the features of handicapped people and low resources. And in which sense, we have certain materials that visualize and give information about the mechanisms, but it turns out that they are not adapted for people, handicapped people, blind people, and when we have this disability, we're not conveying the message. We may see that the line can be available 24 hours, but we need to make this adaptation, and it will be so difficult to people to have access to this. And based on these challenges and what we have is particularities and so we choose Arauca, as Andrea mentioned before, because here we have the humanitarian or the human development, but also the building or the construction for peace. So when we identify so for us, what was the key? Those mechanisms should be suitable so we can receive in a safety way the reports of exploitation and sexual assault and to be treated or to be managed in a proper way. This was the first time we performed an exercise like this. And as I mentioned, and in order to deliver recommendations to all the organizations and agencies who may require this is to start putting the seeds or to start the pilots to address the complaints from the community. We enjoy making the summit Arauca due to its characteristics, but because it is a territory that has been built with the team and with the human team and also supported by different stakeholders of the region. So basically, when we try whatever, once we can say, okay, here it is a mechanism of community complaint, we need to know how to strengthen to have a good response, to identify, and here in the chat, it was mentioned before, to identify this access constraint we're dealing with in terms of respect. So we want to give up proper answers and to support victims. So we are in this process, we are escalating, and at certain extent, it's what we can get in comparison to other countries that they have built in a more a solid way, in a more robust way. For now, we cannot observe this in a nationwide level, just in our region. However, this is our interest as well, to have some of these experiences as well and to strengthen in some other regions such as Santander, Vallarta, among others, with the support of the focal networks. And we are interested in moving in this path with Arauca to establish this topic.
Muchísimas gracias, Andrea y Catalina.
Thank you, Andrea and Catalina.
En otros países también.
And
El proceso es largo.
yes, the process is long, and the learning process is long. To be able to have these channels, we have to have a lot, especially in the communities from the PSEA task force and the IAP. It's always very important to know how to articulate a little better the importance of working together. And you just gave us an excellent example on how to do these tasks that are key to be able to use the channels and key to know how to build ever since we start building a community mechanism, which is obviously based on a very good work of those channels that have to be constructed also in a confidential manner. And thank you for closing with this great key message. I will now give the floor to my colleague, Lena, that will moderate the next section of the webinar. I imagine that the participants wanted to make their questions to the panel members as fast as possible. Thank you to all. And you have the word, Elena. And thank you, Monica, and thank you to all panel members that have been with us all.
Because we have a first question to Elizabeth, but I think it's first to say that all of this conversation needs to be based on trust. And I think some of you mentioned how the work has been done with communities to gain trust and have people that ask questions which are community-based to really build on community-based trust to build a feedback mechanism. The first question on that for Elizabeth is how, and I know that you mentioned that you had at a certain point 800 volunteers asking questions and feedback door to door, but wasn't it a challenge to have your own people asking feedback on the assistance you provide, since that might influence people in the answers that they give, or doesn't it create a bias to have your own people asking feedback on specific assistance or situations that you're working on?
Thanks, Elena. I think that's a really good question and a valid question. I can't say for certain it didn't create bias, because of course I think that is going to be an influence when people are providing feedback to the volunteers. But that's why it's also important to have multiple channels based, that people can provide their feedback to. That is face-to-face channels, but then also online channels and channels where they can just call in. But I think, as I said, a lot of that starts with building trust with communities. The way that you build that trust is by consulting them in every step, ensuring that they understand what it is that you're trying to do through this feedback system. So why do you want to create this community feedback system? What is it going to be used for? Why do you need them to provide this feedback? And really making them understand, communities understand that any feedback is good feedback, whether that's positive or negative. And that requires a lot of work, of course. But I think if you continue to show communities, to consult with them, to show them that you're listening to them, make sure that their inputs are being provided into this system, that it's something collaborative. It's going to create ownership. And if they see that they're sharing feedback with you, and you're responding to that feedback. And that was key for us. You know, we saw that that really helped in encouraging community members to continue providing, you know, their complaints, their suggestions, their questions. So it wasn't just about complaints, it was also, we wanted to hear from them. What do you think of this intervention? Is it working? Is it not? Do you have other suggestions? What are your questions or concerns? We also wanted to understand what people's perceptions were. So we categorize the feedback depending on, different types. And I think that also helps us to understand, you know, what to address and how to address it and when. But yeah, good question.
No, and very good answers. I think it's really like working with the community that you reach that level of trust and openness that you can really like build on to get input, which is truthful and honest, and you can use in your programs. Absolutely. The next question is for Naima, and it also has to deal with trust. And I guess you gain the trust of people when you provide useful information and you can actually connect people and solve their issues. But what happens when you can't provide the referral to a service? And what happens when services simply are not there to satisfy people's needs? Like, how do you manage expectations of people that will not receive an assistance as a result of their contact with the call center? How did you manage that?
Elena, this problem we actually faced in Iraq quite a bit because there were things that we did not have access to, information we did not immediately have access to, especially when the returns to Mosul began. So we realized that the main thing that we could do is just be honest. I mean, because I think rather than just saying anything, it's Fernanda Baumhart actually wrote something very important in the chat, that people's trust is codependent on closing the feedback loop. And she is talking about how that is one of the big challenges that is generally faced. So I think the idea was, what we felt was to be honest with people. And this is where you have to be honest right from the beginning. When people would call in, when we would ask them, you know, the nature of the query. So this is something that as the call center operators became more experienced in dealing with answers, that's when you would know. So initially, if people would ask something and we didn't know what the answer was, we would tell them that we would call them back. So when we had an answer, we would call them back and give them the answer. And when we didn't have the answer, we would call them back and give the answer. Initially, what was happening was that the people for whom we didn't have an answer would not get a call back. That was creating a lot of discontent, and that wasn't done on purpose. I think it just became kind of a natural response. Hey, we don't know the answers, so we're not going to call them back. So there was that. Then as we realized the kind of questions that were coming in as the call center became more and more established, there were things that right off the bat we could tell them. For example, like initially, I remember when there was no housing, land and property working group, when people would ask about their housing or their land when they were returning to Mosul, we would just be like, sorry, we don't have an answer. But then once the working group was established, then we knew that, okay, there's, we can guide them. But again, two main things: honesty, because you have to give them that human respect, you have to be honest with them. And second, making sure that even if you're going to, if you don't have the answer then, and you don't have an answer later, call them back and let them know. That was the main thing. Yeah.
Thank you so much, Naima. And I think it's two very important points, especially on closing the feedback loop, because we know that, like, sometimes even knowing that there's no train is better to be there left waiting for a train and not having answers. So definitely very important to always make sure that we get back to people, even though the answer is not what they necessarily want to hear.
And very quickly, and I think this is where I think things like this webinar are very important, because we can actually share this with other missions. We can share, these learning lessons, the lessons learned, so that people are already prepared on what to expect, and that however T's we can cross, and however many I's we can dot, we can do that.
Absolutely. And we have one last question. We have more, but unfortunately the time has no mercy. We have one more, and it's a little bit for everyone, and perhaps building on what Naima just said of making sure that we close the feedback loop, or what Elizabeth was telling us of the 800 volunteers to ask feedback in a very thorough way. There is one question that came in, and it's not specific to any panelist, it's for everyone. And it's like, it's the big question, like, how do we make sure that we have resources for this type of programs, for this type of projects? And especially was like, what is the cause why donors don't necessarily feel like funding with like important amount of these projects, and what are potential solutions that we can provide so that they buy in more into feedback mechanism and complaints mechanism. I don't know if there's a volunteer there that can help us.
Hi, Elena.
Go ahead, Clara.
So maybe, I mean, it's not, we don't really have a solution, but maybe just sharing from our experience in Venezuela. For the interagency contact line, no, it's something that we discussed. At the beginning, it was only one agency that had the resources to implement this interagency initiative. Then, but after the pilot phase, we needed more resources, no? So we tried to develop a concept note, have the interagency contact line as a project in the HRP, and we went to see various donors, but we were not very successful. I mean, we were unsuccessful with that, because they told us that they didn't want to fund this as a single project, no, apart from what the UN agencies are already doing. So the solution we found was a cost-sharing agreement between the participating organizations right now. And the donors suggested to make sure that the interagency contact line is incorporated in the projects and the programs of the agencies, no? So just like our recommendation was to make sure that it's a part, like it's taken into account when they develop their budgets, making sure that there's sufficient resources for feedback mechanisms, including the interagency contact line, and then part of these resources go into the interagency budgets. So that's our experience from here. Over.
Thank you, Clara. And a very good point is to make sure that the feedback system is actually a feedback system for everything that the mission is implementing at the local level. We have only 1 minute left, so I will pass the floor to my colleague Claudia, so that she can help us with some drawing conclusion and also close this session. But thank you, everyone. Thank you, panelists, and thank you to our participants that asked very interesting questions.
Muchísimas gracias, Elena, y muchísimas gracias a todos.
Thank you, Elena. Thank you to all.
Voy a... esperen un segundo acá.
1 second here.
Voy a tomar solamente algunos
I will take just some specific items, like we have many items in common now that the panel members have been talking. One of the priorities is the importance of being transversal on gender and diversity, on the tools that we have and the mechanisms that we will be implementing. You can see some examples to take into account young people and the teenagers and girls and boys to understand the needs of the indigenous peoples and the importance of understanding that we speak with different people and different needs, not just one sole community, and to think in different mechanisms to ensure that they are accessible. One, for example, the complaint is more sensitive to have mechanisms of face-to-face, and then the others, we need anonymous systems, differentiated mechanisms that will ensure the sensitivity of these mechanisms. Another topic that I think that we all agreed is it is important to consult with the community before starting a different mechanism, to consult to see what they want, what they prefer, how do they prefer it, what are the tools, the mechanisms, where, when, how. And this leads us to analyze what is already established and to adapt to the systems that are already established and not to launch a new, very complex system if there is a structure that already worked. And this consultation reaches to the expectation handling. I don't know if it was Naima that said that we don't always have to have an ideal response, but always have a answer. We can say, okay, be honest, we don't have the answer now. I'm sorry, we cannot cover this need right now. The service is not existent. We are not available. Always transparent with the information. And that is linked to the importance of driving trust in the communities. The mechanisms of feedback and complaints will not work if we do not have a structure based on trust with the community. Any feedback is a good feedback, and for that is very important to stress this to the people that we serve, and also in the way in which we program, always people-oriented, people-centered, and we have to hear very well, but let's learn. And that is very important. The panel members have said it, the importance of taking action. It's not only how we gather information, but how we analyze and we respond to this. And the closing, and this is a webinar is within the platform, is the importance of the possibility of complete efforts one with the other, to do it interagencies with the different organizations, with a different humanitarian structure, avoid parallel mechanisms, because of course we all want information, we all want to have mechanism and tools to gather information, but that is not the most effective sometimes. And sometimes was linked to the last question, to look for donors to have this co-sharing agreement, different organizations, different agencies. Finally, the objective is common. It's the same. The mechanism are not static, so rethink, replan, take an idea to know if they are really working and we are achieving the goal. And with that, I tend to thank the panel members for an excellent webinar. Very, very interesting. We did learn a lot from your always different expertise.
Gustó mucho también, me parecía que lo
And
mencionaba.
lessons learned. I would like a lot what Naima said. We have to know that the systems are not perfect. It's okay. We're here to learn. Thank you very much. Thank you very much, Naima, Elizabeth, Clara, Abner, Catalina, Andrea. Thank you also to the practice community of PSEA, the work team of AAP with the CWC, and thank you to all participants that were here with us. Have a great rest of your day and great week, and goodbye. Thank you very much.